Thank you, Dimitri and Erin. My name is Sonja2, and as part of our multidisciplinary response, the remainder of this presentation will analyse the issue of risky or dangerous driving behaviour in young adults, presented from the perspective of a clinical neuropsychologist. Central to the profession of clinical neuropsychology is the brain-behaviour relationship. I will therefore be examining the origins of dangerous driving behaviour from two neuropsychological orientations. The first one will be neurodevelopmental, with a focus on the effect of ADHD in young drivers, and the second point will focus on the involvement of drugs and alcohol in the dangerous driving behaviour of young adults. In conclusion, I will discuss the specific services available to address this recurrent problem. Attention deficit hyperactivity disorder is a neurodevelopmental disorder involving problems with higher order thinking and concentration. Driving a motor vehicle involves multiple complex cognitive actions, including perception, attention, motor coordination, and impulse control, all of which are impaired in individuals with ADHD, thereby compromising their driving ability. Several studies have found that individuals with neurodevelopmental dysfunctions, such as those with ADHD, were more likely to experience problems associated with driving, including more fines, accidents, driving-related injuries, and suspension of driver's license. One study by Ludoff et al. 2009 reported that drivers with ADHD are twice as likely to be involved in motor vehicle accidents compared with non-ADHD drivers. Furthermore, Fisher et al. 2007 found that young adults with ADHD were involved in a greater number of minor accidents. They had more license suspensions and revocations, and they made impulsive driving errors more frequently and showed less safe driving habits compared with young adults that did not have ADHD. During laboratory studies using driving simulators, Biederman et al. 2007 also found that individuals with ADHD are more likely to experience collisions during monotonous driving segments compared with non-ADHD controls. These collisions appear to be fatigue-related and occur more frequently during the early morning and late evening. However, Graziano et al. 2014 found the risky behaviours of individuals with ADHD are not related to their symptoms themselves, but to the ability of the individuals to deal with their impulsivity in situations with more or less immediate gratification, depending on their sensation-seeking tendencies and effortful control abilities. Neurodevelopmental dysfunction, such as ADHD, is one way in which people can present with risky or dangerous driving behaviour. Another way is under the influence of mind-altering substances, such as drugs and alcohol, resulting in cognitive impairment to the individual. By participating in the consumption of drugs and alcohol, young and inexperienced drivers are inherently partaking in risky behaviour. According to several studies, the riskiest drivers are young people during their first month driving unsupervised in traffic. According to Parva et al. 2013, young drivers are characterized by sensation-seeking, which leads to risk-taking for the sake of excitement. Furthermore, inexperienced drivers may not fully acknowledge the danger of impulsive and thoughtless decisions while driving, for example, passing other vehicles when it may not be safe to do so, or driving after drinking alcohol or taking drugs. In addition, other studies have shown that young drivers demonstrate lower levels of impulse control and constraint in comparison with more experienced drivers, both of which are psychological factors that predict risky driving and may explain the reason that young adults consume mind-altering substances before driving a motor vehicle. Many studies have established that driving performance is impaired by drugs and alcohol, even in low dosage. Alcohol is a drug whose main effect is on the central nervous system. Unlike anesthetic agents that depress all brain functions, the effects of alcohol are first manifest in the brain centers involved in highly integrated functions, such as skilled performance. The analysis of sensory information, the control of intricate movement patterns, and short-term memory are especially sensitive to alcohol. According to Moskowitz and Robinson, 1988, the effects on human skills and performance commence at the lowest measurable blood alcohol concentrations and increase in a roughly dose-related manner. It is therefore reasonable to assume that alcohol-induced driving impairment in inexperienced drivers is a very dangerous risk to their driving capacity. After discussing the relative risk of neurodevelopmental dysfunction on young driving behaviour, as well as the impairment caused by the effects of alcohol, I will now discuss the services available to address this issue in reference to evidence-based practice. Regarding the recommended practice surrounding the treatment of neurodevelopmental disorders, it is suggested that young adults and their parents or carers should be counselled about the possible driving risks associated with ADHD. In terms of contingency management, Barkley and Cox, 2007, report that behavioural interventions have proven to be largely ineffective, as treatments that are needed to alter the driving behaviour of individuals during times of motor vehicle operation would require caregivers to be always present to apply the interventions. At present, Barkley and Cox, 2007, suggests that medication is the only treatment that meets the requirements of ADHD intervention. Therefore, it may offer some hope for improving driving performance and reducing risks. Regarding the available services aimed at reducing alcohol and drug intake for young drivers, education and law are two general approaches that have been used in efforts to prevent drug and alcohol-related problems in young people. The legal approach emphasises restricting the blood alcohol content limit of young drivers in a bid to enforce better decision-making processes. The educational approach, however, suggests that successful interventions should focus on primary prevention, because it is easier for a person to avoid forming a habit than it is to change a pre-existing habit later. In addition, risky driving has been decreased successfully by such indirect methods as teaching social competencies and relaxation skills. In general, teaching behavioural methods for controlling risky behaviour is a more effective approach to the prevention of crashes than attempting to change underlying attitudes. In conclusion, I reiterate that the problem of risky behaviour in young adult drivers is complex and multifaceted. It is only through a multidisciplinary approach that we may shed light on the best way to address all the issues involved. Thank you for listening.